Dr. Henry, you're a medical doctor and you specialize in the heart.
I'm an internist, and an area of my specialty and focus more recently has been around cardiac disease and stroke.
What can we do to prevent cardiac disease and stroke?
A lot of that risk that's associated with having a heart attack or having a stroke, we can do something about with lifestyle changes. The major risk factors are high blood pressure, smoking, obesity, having high cholesterol. So some of the changes that we can make in terms of our diet, getting more exercise, being aware if we're at risk by knowing our risk factors, we can actually make some changes in those risks.
How do you know your risk factors?
Well, one of the first ways to know your risk factors is to know your family history. If there is a history of someone in your family having had a heart attack or a stroke, it puts you at a slightly higher risk. The other more important way is to know from visiting your doctor if you have high blood pressure, get your cholesterol tested so that you know if you have high cholesterol or not, and also by changing and stopping the things that may put us more at risk, like smoking.
What are some of the changes in the diet must we do?
Well, one of the things we need to decrease is the amount of saturated fat in our diet. So doing simple things like taking the skin off of chicken before we cook it, less frying and more baking, getting more vegetables and whole grains in our diet, decreasing the amount of fats that come from dairy products like whole eggs and whole milk. Those are simple things that we can do that decrease the amount of saturated fat we take into our diet.
Fried food is harmful. How harmful?
Fried food, because often when we fry food, we do it and it increases the amount of saturated fat. The saturated fat is the type of fat that's in the diet that puts more of the bad cholesterol at risk in our systems. So by decreasing the amount of frying that we do, doing more baking, more broiling, and again, more leaner cuts of meat, more fish, more chicken without the skin, those are some of the things that will decrease the amount of fat we have in our diet.
What about steak and pork chops?
I know we love them, but they're not so good for us. I think it's a part of changing how we think about food because, and maybe instead of that steak, maybe it's a piece of chicken or a piece of fish that's not fried, but broiled. Reducing the frequency of which we have that piece of steak and cutting the fat off of it, making it more lean.
Sort of fried catfish and all of that kind of stuff is harmful.
You're breaking our hearts, but yes, because the more we can reduce that, and it is a change, but it's a positive change. I always like to think about diet of eating brown rice, getting brown bread instead of white bread. Those are some of the changes where we get more whole grains in our diets that will reduce some of our risks.
Why brown rice rather than white rice?
A lot of it is by retaining the nutrients that are inherent in the rice itself, and this is just one example. When we strip away the coat around that rice kernel, which has a lot of the nutrients in it, we lose some of those more healthier things that we're taking into our diet, and it's really all about balance. I think one of the things we sometimes think is that we'll have to make radical changes, really difficult changes, in order to get into a healthier eating lifestyle. And we don't. And I think part of it is by doing some of the simple things that can help us actually be on a healthier lifestyle.
What about potato chips and Fritos and all those kind of things that people eat all the time?
They taste good, but they're not good necessarily in terms of if you eat a lot of anything that's fried. I think you're again putting more saturated fat in your diet. So a lot of it again is coming back to reduce the amount of saturated fats, getting more vegetables and fruits in your diet, and doing those simple things, including exercise, because we haven't talked about exercise, but it's just not about what you eat. It's also about the exercise that you have as a part of your daily routine as well.
Vegetables, collard greens with fat back, turnips with fat back. Is that included in the vegetables, or do you have to modify the way you cook them?
You have to start thinking differently about how we cook. Great it's when we add the fat to it that we change that balance of making them not as healthy. So it's again thinking about other ways to cook. Thinking about whether you, instead of the fat bag, whether you use turkey or some other ways that are not as highly saturated fats. The key is you want to reduce the amount of saturated fat in the diet.